I'm Dorian, the Associate Dean for Public Health Practice, as well as Equity, Diversity, and Inclusion at the UCLA Fielding School of Public Health. I'm also a proud school principal for 10 years, and it's my honor to welcome you all here, hopefully welcoming you back to part 2 of our 2-part collaborative series focusing on the intersection of public health and equity in education, honing in on the issues exacerbated and even more clearly highlighted by this pandemic. I want to take a moment to thank our collaborators at both the UCLA Fielding School of Public Health and the UCLA School of Education and Information Studies. Let me also take this moment to introduce and thank my co-moderator, Ms. Carrie Usui Johnson, Director of Professional Development and Partnerships at UCLA Center X. Today, we're lucky to have with us insightful experts, thought and action leaders, incredible educators and school administrators who are poised to help facilitate this dialogue, to better inform, empower, and create confidence in the decisions we need to take and the actions we need to make. So next slide, please. A few housekeeping reminders. I think we can go 2 slides, maybe even. All right. I know we've been doing this forever, and yet that mute button still remains very elusive to all of us, but please mute if you're not speaking. Turn on your cameras if you want to. I want you to know, as you saw, that this is being recorded, so feel free to leave it off, put it on, whatever you want. Freely chat in the, put your thoughts in the chat, but also unmute yourself whenever you want to, once we have the Q&A open so that you can freely express yourself. As I said, we are recording this so that it could be available for viewers later on. But also let's remember that in this community that we're forming today, we should all feel comfortable and safe to take space, but also graciously make space for one another. Next slide, because it's now my time and my honor to introduce our panelists. We are fortunate today to have with us Dr. Edith Omwami, Associate Professor of Comparative and International Education at the UCLA School of Education and Information Studies, where she teaches courses on theories in comparative education, inclusive education, social context of learners, and research methods in education. Her research interest is in Sustainable Development Goals, the SDGs, and the context of global public health emergencies with respect to issues pertaining to education access, participation, education finance, gender and education, empowerment of women, and nutrition and cognition. Her research examines the diverse learning context for diverse populations of learners with a focus on equity and inclusion for marginalized and vulnerable populations, including children and youth, ethnic minorities, women, rural populations, and those in conflict-impacted spaces. She's also involved in development intervention programming in the areas of education and food security in Africa. Her most recent publications are on comparative perspectives on international early childhood education in the context of SDGs, liberal feminism in comparative education and the implications for women's empowerment, and globalization, nationalism, and inclusive education for all, a reflection on the ideological shifts in education reform. We're also very honored today to have with us Mr. Joseph Wright. Mr. Wright is a doctoral candidate in education at the UCLA School of Education and Information Studies and a master's in public health student at the UCLA Fielding School of Public Health's Department of Community Health Sciences. His research and expertise are on the impact of domestic and international policy related to whole child equity and children's rights, including education, health, nutrition, responsive caregiving, and safety. Mr. Wright received a bachelor's in science from Brigham Young University and a master's of science from Oxford University. He's worked with USAID, UNESCO, and UNICEF, as well as school districts and health departments across the states. We're also happy to have our esteemed school administrators, starting with Ms. Germaine Jackson. For the past 25 years, Ms. Jackson has worked as an educator and community advocate for social change and equity in schools. Her work in public and private education focuses on curriculum development, culturally relevant teaching, student leadership, and community engagement. During her tenure in independent schools, she worked with the National Association of Independent School Equity and Justice team, creating programs, initiatives, and conferences for membership schools. Her recent work in public schools in Los Angeles and Inglewood focuses on arts integration and the incorporation of restorative practices to reduce discipline rates and improve student engagement. And lastly, we're very excited to have with us Dr. Cynthia Gonzalez, principal of the Communication and Technology School at Diego Rivera Learning Complex in Los Angeles County. Dr. Gonzalez is a former candidate for the LAUSD school board, and during her race, she received the endorsement of the Los Angeles Times. She has 10 years of experience preparing high school students for a post-secondary education and 19 years of experience working in Los Angeles schools, specifically in South Los Angeles. I thank you all for being here today, and now it is my great honor to invite Dr. Edith Omwami. Dr. Omwami.
Thank you for the invite. I'm honored to be here to present today. I want to have us think of it as more a reflection rather than a presentation, because I'm also going to do more generalities than being specific. And this is not a scholarly piece, but more a piece in terms of sharing, so that we can all have some insights, understanding, and exchange around the topic. I was asked to present on nutrition and food insecurity. The context is education, and we are here to talk about how we can serve our children and youth and promote learning and promote equality, equity in education. So my focus is therefore on public health and education equity, but I want to have us understand first that the pandemic has in itself magnified the magnitude of inequality. We have cases that would otherwise not have been categorized as vulnerable, households, children, youth, now falling into that space of vulnerability because of the pandemic. And the inequality in itself has multiple dimensions. So whatever happens in one space might actually have an impact on an individual's experience in another space. That is basically the context for the session. Next slide, please. So nutrition and food security pandemic context is my topic. And I want to say that food security, nutrition and food security are not mutually exclusive. Nutrition will refer to the intake in relation to physiology that supports good health. And with respect to food insecurity is the potential vulnerability or the actual deprivation that in terms of access to education. For my presentation, I will mostly focus on food security and food accessibility, because that is what is mostly visible in a school setting in terms of school meals that are delivered to children when they are enrolled and school is in session, and also with the other programs that actually take place when school is off session, for example, during the summer session. I will mostly focus on school-based practices in the delivery of meals and related interventions. Next slide, please. So I want us to first acknowledge that food insecurity is a persisting problem in the country, and with various households and communities differentially impacted. That is the purpose for this background information that I'm giving. It is tied to poverty. That is the main cause of food insecurity or vulnerabilities. We do have, for example, in 2019, statistics that showed that 34 million households lived in poverty, including 10 million children. With the pandemic, of course, the numbers have gone up, and the magnitude of vulnerability, therefore, in total would stand at 1 in every 4 households, which is a big problem if we are talking about a country that is categorized or identified as a wealthy country or wealthy nation. Their vulnerabilities are differentially impacted in terms of populations. So we know, for example, Black households would be more vulnerable, and communities with no fresh food sources as well would also be more vulnerable. Persons with disabilities would actually also be more vulnerable. The numbers have changed, but not that significantly different. The data for 2019 and is presented for us here, and we expect a spike when the new data comes in as we begin to see what the situation was for 2020 as well as 2021, this particular this particular year. Next slide, please. So this particular slide just shows us the magnitude in terms of the impact on different categories of individuals or households or household setup. Poverty is the primary factor, as you can actually see that those with incomes below the poverty line tend to be more highly represented in the category of households either severely vulnerable or vulnerable to food insecurity. Next slide. So what has happened is that the pandemic has magnified the vulnerability for vulnerable households, in the food insecurity problem for vulnerable households. And now we also have more households actually impacted. The idea that we have disparity in prevalence of vulnerability to food insecurity, besides the various categories that we saw, you can actually see that the map of the state also tends to reflect vulnerabilities in different regions. And these regions, we can infer the purpose or the point of this particular presentation is not looking at those factors, but we are aware of farming, farm workers, rural households, inner cities. And so where these populations are represented in higher numbers, you can actually see that the vulnerability to food insecurity is also higher. Right now, under the pandemic, there was an estimate that came out that insecurity was 42 million people, and the numbers went up to 13 million children from the 10 million of 2019. But this is actually assuming that everybody was captured in terms of identifying who are vulnerable, but we understand that that is not always the case. Next slide, please. Okay, so for the state of California, I'm more interested in what is happening in our schools because we are more interested in education and education inequality. So offering opportunities for all students, including students who might be in vulnerable population positions, to be able to access education in the same manner as any other child who is in a privileged or better position to participate in schooling. So what we know is that we can capture vulnerability to food insecurity through enrollment in free and reduced school meals. And what we have in terms of numbers does demonstrate that the state of California actually has very many children who are either very susceptible or more likely to become food insecure at the household level, just looking at the numbers for enrollment in the free and reduced priced school meals. So in 2020, for example, with 6 million children enrolled, almost 60% in K through 12 were actually identified as qualified for free and reduced school meal, priced school meal. So from year to year, if you look back at the statistics, and this can be drawn from the Department of Education, you will see that there has not been very significant difference across the years. In some schools, actually, more than 100% of the student body is enrolled. And you also will notice that SES, the socioeconomic status of the children, is actually correlated with enrollment based on community level numbers. And we understand that some of our communities are actually vulnerable. There is high prevalence of vulnerability, therefore evident from the data that we have at state level in terms of enrollment. So either national, statewide, or even looking at county-wide enrollments. Next slide. So I tried to go back to what the situation is for our county, and the county has one of the largest enrollment in terms of student population, but LAUSD itself, the Los Angeles Unified School District, is actually the largest in the state. And when you look at enrollment in free and reduced price school meals, you can actually see that almost 70% of our students, and this is about 1 million, 1.3 or 1.4 million students enrolled in the county, are enrolled or qualified as potential beneficiaries of the free and reduced priced meals. What that tells us is that there is increased vulnerability at household level, even within the county itself. And you pick the school district, and LAUSD school district itself has over 80%. Over 7, close to 70%. The county is over 80%, meaning within the county, there are actually some enclaves of more vulnerability. So within the school is almost 70%, the school district is almost 70% of the students that are actually enrolled in the free and reduced priced meals. The high prevalence of food insecurity within the schools, therefore, highlight the importance of schools as sites or as hubs and entry points for meaningful intervention in order to deal with the crisis of food insecurity in households from which the children attending are actually residing. So next slide. Now, going back to the pandemic context, a number of publicly funded anti-hunger programs already exist. So that's not the subject of my presentation, but we are aware of SNAP, and even the free and reduced price school meals is one of those programs that are available. So thinking about the federal and state response to the pandemic, one of it was to continue the food security programs that were happening within the school. I'm glad that the PEBT program actually came online to continue with the delivery of school meals to children following the lockdown. The rent assistance program is in itself an indirect kind of intervention, in the sense that, and we understand that if you are housing insecure, you are also more likely food insecure because of the change in your living context. So understanding that if you have rent subsidy or a rent intervention, because that's something else for us to look at and discuss, then there'll be some food availability from the funds or resources that would have been devoted or committed to rent. Now, if you reflect on what the pattern of vulnerability is, we also know generally that there are households that may be housing secure and yet food insecure. So both of those do not go hand in hand, that it is the reality that some people may have been able to keep the house, but still were food insecure. So the pandemic, federal COVID pandemic relief was also a help or a support. And then we do have the federal qualified child credit that will soon be disbursed. That, if it actually continued, the universal child credit support, it would go a long way in supporting food security. It might not necessarily solve, given that we understand the cost of living and the cost of food in this state and this country overall, although in some places it might be relatively cheaper or more affordable compared to other spaces. Next slide. Okay, so I'm interested in schools as nutrition hubs. So the question was, why schools and why school meals? So we are interested in school meals because nutrition is fundamental to supporting attendance and achievement. So if you have a meal at home, you are likely to be able to come to school. But also, if meals are served at school, children are likely to come to school so that they can access meals. Now, this is been proved through research, and my kind of research that I do actually has demonstrated, even though it is a different context, that school meals actually promote school attendance and also promote achievement. School meals also promote nutrition and health of the children. We all know that a healthy body and a healthy mind is actually good for education. So nutrition plays a role, therefore, in student readiness to learn and also in academic achievement. Schools served as hubs for daytime nutrition and food security intervention and access to food for vulnerable youth and children before the pandemic. Next slide. Next slide, okay. Okay, so schools' interest in meals, therefore, sorry, can you go back one? Back. Okay, so school meals were not universally accessible before the pandemic. There are lessons, therefore, to be learned from the practices before the pandemic. We understand the debate about denial of food for children, for example, and we also understand the debate about the adequacy of school meals with respect to nutrition, but more important, whether or not the meals are palatable. Those are some of the things that I would want us to think about in terms of moving forward. What do we learn and what can we improve in the delivery of school meals? School nutrition education was one of the things that was happening. Can you move back? Next slide, please. Next slide. I'm sorry, can we forward, not backwards? Next. Next. Okay, so I will just pick up from where I had left before. School meals were not universally accessible. There are lessons to be learned from the practices before the pandemic, and school nutrition education and school meals and school well-being were also not integrated. So you find, for example, the health services available from at the school site are separated from the school lunch delivery. The pandemic closure disrupted access to school meals at the sites. But we learned, therefore, that it was possible for schools and school sites to repurpose as community sites for food and meals delivery. In 2021, for example, we have an estimate that LAUSD has delivered more than 100 meals to households and families for children attending. The positive part from that experience is that LAUSD sites for grab and go did not also discriminate by enrollment or attendance at the school sites that were actually participating. So there is something or a lesson that we can learn from that as well. Next slide. So for us thinking about suggestions to consider, okay, sorry, back one, to consider back to in-person learning and safe reopening, more attention needs to be paid to the delivery of school meals and services. Some of the things that we have at the back of our mind is considering the nutrition needs of students, collaborating with parents and healthcare providers to meet individual needs of students. So we can say that it is possible that parents would record the nutrition needs of a child, but there was no collaboration or direct collaboration between the schools, the parents, and the healthcare providers for the children, or the healthcare providers that would have been accessible to children to provide those particular services. So food security and dietary needs of the children need to be center also and integral to the practices, to the daily practices within the schools. Collaborating with parents and nutrition or food security professionals to assess vulnerability within schools with schools as entry points to assess household and family food insecurity would also be a good practice because we already have demonstrated that schools could be a site to accessing food or meals for households. So that practice could actually continue, but the schools provide that space where it is possible to determine, to assess, and to evaluate, monitor, and intervene in the event that there is food insecurity and vulnerability to food insecurity at household level. So my suggestion would be to continue schools as sites to mitigate food insecurity for vulnerable children and youth within our schools. So the other is to propose individualized packaging, given that we are talking about the pandemic context and vulnerability to the spread, to promote individualized packaging for school meals and long-term meal choices to facilitate distribution and improve access. Here, my understanding is that rather than wait for children to turn up for a meal, if the children would be given and their families, children, youth, and families would be given an option to propose their meal for the week or for the month so that there is an advanced preparation for safe delivery of those particular meals. Suggestion to consider in back to school learning for meals, more attentions need to be given to be paid to delivery of school meals. Consider nutrition needs of children. Sorry about that one. About safe reopening, schools have to be, have or will be opening following CDC and state public health guidance for prevention of spread. So what we know is we have to wait to be advised on school reopening. We have already had a run where schools have reopened, and we are looking forward to learning from our colleagues who are practitioners and who are based in those schools and who are to deal with the day-to-day for the short period that children were in session. LAUSD in itself has in place the integrated safe school plan guide, which is being updated with time with new lessons learned and readiness for the next school year. The focus for us from that plan would be item number 2, and that is student health and human services. Our suggestion would be nutrition and food security to be considered integral to the public health component of the ISSP in terms of designing, implementation, and monitoring. And also to universalize access to school meals. The positive part of it is that the state actually is voted to universalize school meals. That would eliminate vulnerability during the daytime in terms of access to school meal, in addition to proposed child credit. So the two would work in tandem, that there would be a possibility for household food insecurity to be lessened and the child to have access to school meal if you have universal access to school meals. At least this will eliminate the challenge that we have faced where some children are denied school meals. Also, school health services to integrate child and youth wellness and also make it an integral part of the curricula and extracurricular programming. So those of you who may have interfaced either as parents or as students with school health services understand that it is not part of the regular classroom interaction. It is almost a mini health service or triage center for children to be for children to have access to the caregivers or guardians who would then actually access healthcare services for them. So our suggestion is to work with parents and childcare health services providers within the schools and those that provide healthcare for children, so that there is actually a more coherent and collaborative strategy in addressing the well-being and health needs of the child. Next slide for me, please. So thank you so much for the opportunity to hear what I have to share. These are my personal notes from my experience working in schools, as well as researcher and a parent as well. Thank you.
Thank you, Dr. Omwami, for your insights regarding the impact of nutrition and food security. That's a lot to consider, so much to consider as we think about the intersections between equity, education, and public health. And so we're going to continue that conversation as we transition to our first Q&A session. So I'd like to invite our school administrators to join our conversation with Dr. Omwami. Please welcome again Dr. Cynthia Gonzalez and Ms. Germaine Jackson. And we're going to start with Dr. Gonzales. You have a question for Dr. Omwami.
Yes, thank you for that presentation. As you mentioned, the work for LA Unified as an LAUSD employee, I know the superintendent really went above and beyond in providing not just students, but the entire community some of those basic needs during the pandemic with meals. How do you think this can become systemic in our district and as a model for all schools, given that we did have to have like separate staffing to make sure that that happens, funding, all of that? How do you envision collaboration to make this a systemic practice?
I want to first start by acknowledging the great work that the superintendent and LAUSD community actually did in delivering meals to households, because the school closures actually abruptly disrupted the only source of food for some children, because for many of them, you'll find that vulnerable children, that school meal might actually be the only source of food. So to expand beyond and not discriminate based on enrollment at school, and also establish sites other than just school sites in itself, was very responsive of LAUSD. So what we would ask is if there is a way for there to be built-in funding, particularly given SB 138, that funding that can actually accommodate to provide resources for more partnership with non-school when it comes to delivery of meals that would help mitigate food insecurity at household level. So during the pandemic, reorienting the science continued to serve, and I would expect that one of the responses we would have is to continue that pattern, that to use, if the LAUSD wants to not necessarily serve non-school households, they can still serve school or households for children who are enrolled in the household beyond the school meal, so that we continue that practice of accessing food for those households. I would also suggest to accommodate for children early dinners, since we are talking about universal access, because it supports learning. If a child has a dinner and is not going to wait for the parents to come home, or is unable because there is nobody to prepare a meal, they'll be ready to actually continue with their homework, for example, at home, if they are guaranteed a meal and if the meal is actually available. So early dinners would be something universally accessible through the schools to the children as well. Okay, so then the other is to think about support and supporting child and youth well-being. This is where I'm calling on the schools and the school district to work with healthcare providers, so we are not separated as education and public health workers, so that we can continue to support the well-being of children beyond just school meals or just nutrition. I hope that one in a way answers your question. So it comes down or boils down to resources and resource availability. And we are hoping that the school district is going to do its best to access resources that are available within the community and from the state so that we can continue to deliver good nutrition for children to prepare them and promote their learning.
Thank you.
Our next question, thank you, comes from Ms. Jackson.
Yes, with our schools envisioning having a later start with the beginning of the 2021-2022 school year, how do you envision incorporating other wellness practices to ensure that all students are able to participate at the highest level? So for example, with this later start, how would that impact students having access to breakfast, different things like recess and playtime, just how the later start will impact the school day and students having access to these nutritional programs?
Okay, so personally, I want to start by prefacing that in as much as we have heard that there is loss of learning, but I also know that there is more learning that happened in the context of the pandemic that is not categorized the way we have generally understood learning to be. And also, children have actually made progress and children have adapted. So we can still adapt and still be able to meet the educational needs of the children with late opening, but also guarantee that they are prepared by making sure that they have access to meals. Now, going back to answering the question of how we can do that, I do have some suggestions, and part of it is learning from each other. So best practices in different schools can be shared, and that is a good starting point. Then the district itself needs to work towards making resources available in ways that promote equity in both infrastructure as well as physical infrastructure as well as human resource across schools. Part of the issue of inequality is not that there is a meal or no meal. It is because there is already inequality in access to resources. That is infrastructure and human resources. Those of us who look at issues of inequality understand even the teachers themselves. We have schools without adequate staffing. The administration, we have schools without adequate staffing. So the school district has to actually center equality and equity in their practices when they are working with schools. The other is facilitating access to quality foods in their choices of school meal options for students. If we are thinking about nutrition and food security, we should also be thinking about whether or not we are promoting good health. So that is part of what we need to think about, that the meal choices, we need to actually focus on promoting meal choices that are actually healthy, because a healthy meal would lead to a healthy child and a healthy youth who is ready to learn. So the choices is something that we actually have to think about. Then the other is thinking about the delivery itself. So I mentioned about individualized packaging, but also think about how to work with communities so that the meals actually are derived from or come from those communities in terms of proximity to the sites of consumption. And that might actually promote delivery of quality meals, because we know we have like restaurants and food production spaces that are available within the communities that can actually deliver. That would also promote the socioeconomic well-being of those communities rather than bringing meals from further outside of the community. So I hope that one in a way answers that one.
Yes, thank you.
Thank you. And our last question, Dr. Gonzales.
Yes, so I know you mentioned the partnership or collaboration with healthcare providers. What type of collaboration between schools, districts, and healthcare providers can be imagined to close the health gaps that exist in communities of color, as well as increase the access to quality foods and decrease access to processed foods? And I know you just mentioned proximity in what you just said.
Okay, so proximity is one. The other is engaging with parents and communities and schools around health, and also with researchers thinking about collaborating so that there is monitoring and evaluation and assessment using even the data that is already generated within the school. So every school year, every child is turning up with a health record. I have no idea what those health records do because I'm more familiar with statistics on poverty, enrollment, attendance, including expulsions and suspensions, but I don't see a lot around health, even within the database for the Department of Education. If we can use that data and there is skills in our community from parents, from schools and health workers and researchers who can actually triangulate the various data sets that they have in order to work towards supporting the child in health and in education. And I can give an example of monitoring child growth, for example. You have healthcare service providers at schools. If they can engage more in monitoring growth, they can actually help with the nutritionist providing adequate nutrition in collaboration with the parents and the pediatricians who are actually treating these youth and children to tailor their dietary needs for the specific child or the specific individual. But at community level or school level or even county level, just the aggregate of the data that is generated from the health could actually help with public health interventions within the schools. I'm not familiar with how much of it is accessible to the public health people because I'm more familiar with the data that is available on the education side to the education people. I would like to see the partnership between educators and public health people in terms of attending to what is happening, using data to inform decisions that we actually make.
Thank you.
Yeah, thank you, everyone. So much to think about as far as nutrition being a bridge between public health and education. So thank you all for participating in that great first discussion. I'd like to next invite our next speaker, Mr. Joseph Wright, and who's going to speak about education technology and wellness. So thank you, everyone, and welcome, Mr. Wright.
Thank you so much, Carrie. Really appreciate it. And thank you as well to everyone on this call for taking time. We know that the questions that are being discussed are questions that all of us are grappling with. And there's no easy answers to all of this, right? And I've been working with various entities over the last few weeks over summer camps and different things. And it's always amazing to hear the struggles and the challenges, but also the excitement that's coming out around a lot of this. So and a special great gratitude expressed to Dr. Omwami for her comments around nutrition. And last but not least, the entire Fielding School and Graduate School of Education and Information Studies at UCLA for putting on a really important question that I think all of us need to grapple with and conference around that. So today's conversation is largely around this idea of educational technology and well-being equity by design. So there's a lot of words in there I just want to quickly unpack. So first of all, educational technology, we'll get to that, but I want to focus on this well-being concept. And this is where we see a lot of overlap between educational technology and also the digital divide. There's a lot of research coming out that kids and students who lack some of the educational opportunities, some of the technology in the home, are experiencing lower levels of well-being. And we really want to draw that connection. And some of the early research is actually pointing to teacher burnout from the last year as well. So as we go through this, even though I'll be talking about students, I also want to highlight that I'm cognizant of the fact that we also need to talk about teachers and administrators and the impact that they are experiencing to their well-being as we think about educational technology, what comes, what goes, and also this idea of making sure we do that by design. And I'll emphasize that principle over and over. It's the idea that oftentimes we think technology, if we just implement it, it just takes care of itself or whatever. But over the last year, the pandemic has made it explicitly clear and we knew this before, but sometimes we forget, that we have to design the technology in a way to accomplish the equitable ends that we want, or else the most marginalized will be forgotten as we go along. So I'm going to lay out the basic points I'm going to make here at the beginning, then I'll kind of go through them, and then I'll end with the same point. The first is the idea that the tools, processes, and theory of educational technology, we're at a point where they can't be separated from the learning environment, especially post-COVID. And this is especially true because educational technology is core to not only a student's academic success, but also their overall well-being. Just as Dr. Omwami mentioned several times, as we think about children holistically, we absolutely want to draw out the fact that their well-being is connected to the experience they're having in the classroom. And educational technology is a critical aspect of that. And also the idea that inequality or the digital divide that all of you have been facing and struggling with over the last year, it moves well beyond the technology itself. And it moves into things as process, as well as the educational theory in the classroom. And what we mean by that is students may all have the technology, but do they know how to use it? And this is the same with teachers. Do they know how to use it in a way to maximize it for its benefits? Or is it causing more stress and anxiety? Is it causing more depression, signs of all these different issues as far as the struggle to adapt to very much of this learning environment? The next thing that we really want to bring out in this conversation is that all of us need to take a lot of reflexive time to ask the question of what are we going to keep? What are we going to get rid of? And what are we going to change as a result of this pandemic when it comes to educational technology and student well-being in the classroom and beyond? The most successful school districts, again, as I mentioned, I've been consulting a few camps and other groups over the last few weeks around this issue as well. Those who are having the most success that I've seen by far are those who are taking a holistic approach to well-being and educational technology. They're not just asking a question of what do we keep, what do we get rid of, but they're moving beyond that question, asking how can we use this not just to improve learning, but to improve student outcomes and well-being overall? Or how can we use technology to improve teacher well-being in the classroom? And these are the critical aspects of equity that I really want to bring out, that we have to bring these design principles in to ensure that they go the way we want. At the end, I'm going to end with just to beware, right? Be wary of the false promises of technology in education. We're seeing some narratives that we've seen over and over again over the last 20 years, that technology is going to change learning, that technology is rapidly changing everything that happens, that classrooms will be no more, that it'll make teachers' lives easier. And all these narratives we know are not true. Any teacher who has brought technology into the classroom knows that it can make some things easier, but a lot of things it makes more difficult. And when we talk about well-being of students and teachers, we really, really want to be reflective about that reality and not buy into these false narratives. So educational technology, as students approach the classroom, if a student showed up into a teacher's classroom and they were lacking some of the basic things they need to succeed, right? So if they had not showed up having eaten, just as Dr. Omwami said, we would show concern. If they were not showing up with proper hygiene, right? With clothing that helped them be able to feel safe and accepted in their environment. If they were lacking things like a book bag, right? Or books, we would show concern, right? And we would have resources available. The reality is that technology, including Wi-Fi and the device itself, is becoming as important as any of those other items in the child's life when it comes to the educational experience as well as well-being. But it's not just the computer, and it's not just the hardware. It's not just the Wi-Fi. What it is it's the process and the theory as well. And that's what we mean by technology is becoming more and more important. Some of the best research we have on the digital divide is that Wi-Fi and computer access is only a small portion. But in reality, the divide is between students who at home have iPads and computers and phones, and they see their parents, using those things, and they learn how to use them from a young age, and they know how to access, word processing, and they know how to, do simple things like change the font, versus students who come home and their home may have one computer for the whole home, or maybe no computer. They may be used to a cell phone, but there's no iPads, there's no tablets. And so they don't learn the skills of word processing. They don't learn how to, do things around PowerPoint or these other places. And so where we see actually a larger divide amongst students today when it comes to educational technology is actually around the process, how to use the technology. And that's something we really, really want to be cognizant of. Not only are we worried about tools, but we're worried about process and also theory. And when we talk about theory, what we're really highlighting here is educational practice. Do students know how to use technology to supplement their learning? Do they know how to use technology not to replace the classroom interaction, but rather, do they know how to use the technology to do a report? Do they know how to use the technology to check their grades, to see what they're missing? Do they know how to use the technology to communicate with friends or with other experts in an area or with their teacher themselves? These are the questions that we have to always be careful, especially as we come out of a post-COVID world, is not only how are we doing with tools, but how are we doing with the process of educational technology, as well as some of the theory. Now, well-being becomes really, really important to this conversation. And well-being, when we speak of it here, there's really no set definition of well-being, but the Centers for Disease Control has given us a good sense of maybe some of the key aspects of this. So well-being, as they mentioned, includes elements of positive emotions and moods. This idea of being content and happy. Idea of the absence of negative emotions, right? Depression and anxiety, which as we see is growing both longer, but also is getting more intense in students. And the pandemic has brought this out. There's a lot of really good research asking questions on, is it the technology? Is it the social isolation? We're going to address some of those in a little bit here. But we have to always be in our mind as educators, asking ourselves, am I only concerned about the students' access to computers, or am I concerned about their well-being? Are they satisfied with their life? Are they feeling fulfilled as they use the technology and interact in the classroom? Do I see positive emotions and positive moods as they interact with the computer and with technology? Now, listen, I have a master's degree in learning and technology, and I've spent a lot of time consulting with school districts, classrooms, a wide range of different places around this idea of technology. We all know that there are not always positive experiences and positive emotions when dealing with technology. All of us could speak to that. But what we are interested in are the chronic cases, the case where we have a teacher in the classroom who is so anxious about the use of technology that they're not able to be their best teaching self. And it's the same about the students, is we want to be cognizant of that fact, of those teachers and students who, because of the experience with educational technology, they are not living the positive emotions and fulfillment that we would hope to find. So some of those connections between well-being and educational technology that I hope all of us are thinking of, right? And you as administrators and educators are brilliant at this. As I think about the students that I work with and prepare to go out into various places here at UCLA, as I work with some of the undergrads that I'm teaching or others that I work with, it's these connections that we want to make sure that we are watching. So the first is the idea that I've been talking about, that education is a basic resource. And having a basic resource does lead into well-being. Having food, nutrition, clothing, housing, all these different things really impact well-being of individuals. The next thing that we really want to bring out is this idea that technology can help with social connections. Now, let me be explicitly clear here. I am not saying that technology should replace social connections. In fact, I'm going to make quite the opposite argument, that as we transition to a post-COVID world, we need to make sure that we're fronting the actual human interaction, the student to student, the student to teacher, and so on and so forth connection. But we do recognize that social connections can be enhanced in the digital environment. We always have to ask ourselves when we're dealing with educational technology, 2 questions. What is technology good at? And those things that we know technology is good at, we need to lean more into. And then the second question is, what does technology hinder? And we need to stay away from those things. Technology, for example, makes things more efficient, like grading, like keeping track of students' grades. So of course, we're going to lean into those situations with learning management systems and so on. But technology is not good at equity. Technology is not good at making sure that the students are having a positive emotional experience, the things that teachers are really good at doing. We cannot replace teachers with technology in those cases. We have to be extremely reflective as administrators, as teachers, and as students about what is technology good at and what is technology good at, not good at, and leaning into the right direction. Next is this idea of physical, mental, and emotional health. Around physical health, interesting enough, we're seeing some trends around physical education teachers in the United States, where some school districts, in an effort to cut spending, are using technology to replace PE teachers in order to save some money, which around personnel and other constraints. Now, there's enough money in the system right now that hopefully that's not the case in all places. But the idea that make sure we're not losing that. Now, technology can also supplement physical activity. We've seen evidence of this, whether it's students are watching exercising videos and then participating in those and understanding better about how to do that. But also this idea of mental and emotional health, I want to spend some time on. We know that there are some connections that are becoming clearer and clearer as the data gets stronger and stronger, that the correct use of educational technology can lead to positive socio-emotional experiences that improve mental and emotional health. But too much technology, and technology used in the wrong way, especially for girls in school, when we talk about cyberbullying and some of these other things, can actually lead to lower levels of well-being. And there seems to be some connection, especially for young girls, between education technology and social media especially, and well-being overall. And we always want to be cognizant of that reality. Next is this impact on child development. This is something that, again, the data is relatively new. We're exploring more of it, but we do know that the constant use of technology by young kids especially is rewiring the brain. In some cases, there's those who say it's good, others say it's bad, we're not sure. The brain rewires itself often in various different reasons, especially as there's environmental stimuli. But what we do know is that there is an impact. And we have some really great research, especially from Dimitri Christakis and his group up in Washington, that are looking at, especially post-COVID, what has happened to the learner's brain, whether it's from attention spans, all the way to their ability to retain information, especially around short-term memory. Now, I mentioned that phrase earlier, by design. And the reason why is because the current learning system, and I'm talking about the learning system overall, usually around the United States, is not designed to produce equity. This is something I don't think is a real shock to anyone. It's designed to educate students, but it's not designed to really bring about equity. So when we interject technology and educational technology, especially in a post-COVID world, into that system, right? So the system itself exists, it's already geared to produce certain outcomes which are not equitable. But when we interject technology into that, technology is notorious for speeding up processes. So if we do not think carefully about how we bring technology more so into the learning environment, then we can actually have the unintended consequence of speeding up inequities in technology. We can actually help certain learners learn better, and we can help other learners get further behind. And as a result, we are only perpetuating and at times increasing the digital divide. So for example, yesterday, this tweet was taken from Vice President Kamala Harris's account yesterday. And what I want you to notice about this quote, again, she's talking about high-speed internet access. I think any educator who says this, especially after this last year, can absolutely agree with this comment. Far too many Americans still lack access to high-speed internet. But what I want you to pay attention to is the lack of discussion around things like far too many Americans, especially kids, know how to use technology equitably as their peers. There's not this discussion around the process and the theory, right? As well as things like teachers and administrators who may be intimidated by some of that experience. So we tend to hyper-focus on the tools, the technology, the hardware itself, and ignore that the educational inequality and the struggle with well-being that will be there largely will come in these other areas, usually around how to use technology, how to use it efficiently, as well as how to use it for the right ends. So as we get ready to close, well, at least this portion, and I'm sure some will come out more in the question and answer, what did the pandemic teach us? One, education and learning are inherently social experiences. Kids were clamoring to come back. Not all, but most kids were clamoring to come back to the school. They wanted to be there. They wanted to see their friends. Just this past week, I was working with a summer camp of a couple hundred kids. And it was amazing to see how anxious they were to have their social experiences, to be engaged with each other. But once they got over that, it was like magic. Some of you experienced this in that post-return in some of your school districts. It was amazing to watch their social progress. Second, whole child approaches are needed. We can't just focus on the hardware without focusing on some of these larger approaches. Next, inequality is deeper than access, just as we were talking about. Next, students are not all the same. Some thrived during COVID. They were more comfortable than ever. I sat with a young man, I think it was on Saturday, we were doing some assessments, and he has never been happier than when he was at home doing his schoolwork, interacting with friends on video games. And we have to be cognizant of that. We have to be aware of that. And we have to think critically about what that means in certain situations. The next one is one that a lot of teachers bring up as I talk with them. It's this idea that, you know, before the school districts and the state and others were hesitant to say we can make exceptions, but all of a sudden the pandemic came and we found flexibility everywhere we could, which brought questions into the system. Can we be more flexible? Can we accommodate more learners in unique situations, especially our marginalized learners? Next, educational technology companies, we need to put pressure on them. As educators, we have a responsibility. They are the ones driving the technology, and we have a responsibility to be vocal in the design of that technology, to be vocal in demanding more of these companies to help us produce equity from the beginning. Now, what shifts did we see in pedagogy as a result? These are if I had to say 3 takeaways in pedagogy that we've seen as a result of the pandemic, it would be these 3. First, small group peer-based learning offers valuable and engaging learning structures. Now, this is no surprise to every teacher and administrator on this call. We know this is true. Technology allows us to do it in unique and helpful ways. Second, educational technology can help leverage collaborative tools to support project-based learning. Now, I'm not talking just about flipped classroom models here or all these other fancy terms that we have very sketchy data on. Instead, what we're talking about here is we know students need to collaborate, and project-based learning does lead to good outcomes, and technology can help us leverage some of those experiences better. And lastly, it's this idea, and this is one that teachers especially and students really resonate with. Before, a lot of the world was shut out to us because we had our classroom. But now we're entering a world where we can bring the world into our classrooms in ways we never thought imaginable. Guest speakers who were hesitant to come into classrooms are more than willing to do so now. And it has been amazing to watch this take place as we have students meeting with astronauts on a more regular basis than ever was done before. It happened before, but now it's more ever than before. We have mayors who are able to be in 2 or 3 classrooms at the same time. We have peer-to-peer interactions among students across school districts, states, and others. Things that we were doing before, we can lean into technology to do better. This idea of bringing the classroom into, or bringing the world into the classroom, this is an example of where if we lean into technology, it can fulfill a really great purpose here. And it doesn't add as much stress and anxiety as other cases. Now, as we talk about educational technology well-being, I want you to always remember it's a full spectrum. Students, teachers, staff, and administrators all experience issues with well-being as a result of what they're going through in the classroom. And we have to always be cognizant that the teachers are experiencing issues with well-being and technology just as much as students are. And we have to be sensitive to those realities. Now, lastly, as I mentioned, a warning. One place that as we lean into technology is that it can create more anxiety and depression, especially for teachers. And we do not want teacher burnout. A great example, some really, really great research out of Australia by a researcher named Neil Selwyn, has really helped us highlight that the introduction of technology into the classroom did things like make teachers available 24/7 via email. They never got breaks. We saw heroic efforts during the pandemic. Teachers who were going to kids' houses, sitting on their front lawn, doing math with them outside through car window. These are very touching things, but we know that it's also not sustainable to do that long term. And so as we think about educational technology and well-being in the classroom, and especially around the issue of equity, we know that producing equity requires us to think about the most marginalized and really, really focus on them. So I invite you all to engage in a reflexive thinking. And this is something that students need to do, teachers need to do, administrators need to do, and we need to talk to each other about it. And we need to ask ourselves, what's working? What hasn't worked? What have I changed in my pedagogy that I want to keep, and what hasn't? And ask questions like, how will this impact marginalized learners? And in what ways can we be more sensitive to their needs? So as I close here, I just want to re-highlight the points I mentioned, that technology, and especially the digital divide, cannot be separated from not just the tool, the Wi-Fi and the computer, but also the experience that students are having and teachers with the technology itself. And second, that technology directly impacts the well-being of learners, from depression, anxiety, to social connectedness, to all these different things. We need to always be sensitive to that reality. And lastly, I just encourage us all to be very, very cautious. I cannot stress that enough. We need to be very, very cautious to the reality, to the strong reality that teacher burnout is real. And that if we lean too much in technology, if we lean into the wrong direction of technology, that we can create worse issues with well-being. So thank you so much. I appreciate it and look forward to fielding some additional questions.
Thank you, Mr. Wright, for your thought-provoking talk. We all know that the intersections between educational technology and well-being is of great interest and concern, especially after the past year and a half. So thank you for the opportunity to rethink the digital divide through attending to tools, process, and theory, and also attending to our educators, because teacher burnout is real. It's something we definitely want to acknowledge. So we're going to transition now again to our second Q&A discussion. So welcome back our school administrators, Dr. Gonzalez and Ms. Jackson, and also to join our conversation for this second conversation, we're pleased to be joined by our CDC public health scholars, Phuc Nguyen and Tera Lloyd. So welcome everyone. And we're going to start with our first question for Mr. Wright from Ms. Jackson.
Thank you so much, Mr. Wright. Great presentation. Just to start off, my first question is really about, as we begin to prepare for this new year, what are some things that you think that we should keep in terms of our remote and hybrid instruction? And what are some things that you think we should never do that again in education?
Well, I think all of us will admit that we never want to do the pandemic again when it comes to education. I think we can start there. I think I highlighted just a few of the things that I think are best from a pedagogical standpoint. One is this idea of small groups and peer-to-peer, and technology can facilitate that in a lot of really great ways, especially when it comes to travel. To be honest with you, we can save a lot of time by not traveling as much using technology. I would, again, also say that taking out a lot of the administrative burdens through technology has been really great. Using technology to facilitate meetings, parent-teacher conferences, a lot of these things that required us to translate, to move, required time away from family, friends, and others, we can solve a lot of that. And those are places where I think leaning into technology is really great. As I mentioned, bringing the classroom or bringing the world into the classroom. It's very normal now for us to email people and say, can you join via Zoom at this time? People are very willing. They're used to it now. They know how to use the technology sometimes. And so those are things that I think we can lean more into. Things that I hope we never have to see again. Include just the constant 24/7 that especially teachers went through and administrators early on. Technology can be all consuming. And when you get a buzz, it can be really tempting to have to go and answer it, right? And so that's one thing that I hope we can set really good, clear balances with. And I think that just takes time. Curious, and I look forward to further discussions from teachers and administrators on this call to their experience with some of that as well.
Perfect.
Thank you.
So
Our
my
next question. Yeah.
Yes, my question is, in what ways does remote instruction support special education students? Specifically, what programs should be added, excluded, or incorporated to best support students with special needs, especially those with pre-existing conditions?
Yeah, this is a great question. Now I'll fully admit my specialty is not in special education, but I spend quite a bit of time with special educators. Just as I mentioned over the weekend, I was with a group of students that we were doing some focus groups and interviews on, and they're all on the autism spectrum, right? So they have experiences with autism. And this is a group of people who thrived during the pandemic. They loved it. It was great for them. And so I think there are ways that, especially as we think about our educational plans for these students, that we can ask those two simple questions. Where can we lean into technology? Things like allowing them to really engage, to kind of be in their own little space, to have control over that space, especially with those, whether they're autism or other places. Another group of people that really thrived during this was students with dyslexia and some of those other things who were able to use technology to mediate it. One thing that came out of it, and I'll use our example here at UCLA, but I think it applies to the K-12 situation as well, is we found ways to make a lot of exceptions that we did not know we could make before. We found ways to let students take more time. And you know what? They still learned it. And people were better off as a result. We found ways to not be so hard on deadlines or other things, and students got work done. It was almost a mindset shift more than anything, especially with students who had some of these special education needs, that we were willing to be more flexible, because whether it's the pandemic situation or whatever it was, and you know what? No one was worse off. In fact, a lot of people were better. In a lot of cases, we found it didn't lead to major administrative burdens, especially if you have a good learning management system. And so I would, in this case, honestly, probably advocate more than anything for that continued sense of understanding and flexibility with special education students and their families, and recognizing we could probably do more for them. Why being reasonable? As you can tell, I'm very clear on protecting teachers here. But at the same time, we probably could be a little more flexible, especially if the bureaucracy is willing to support it. That's something I also hope I should have mentioned stays, is all of a sudden the bureaucracy was much willing to support flexibility. And we were very, very grateful for that.
Thank you. Ms. Jackson.
Yes, you mentioned and talked a little bit about this earlier as relates to building those social skills. Again, as we go back into the new year and have many of our students back on campus, what are some recommendations that you have for teachers to incorporate social skills or playtime in the classroom to help rebuild these social skills?
Now, to me, this question is actually really important for the issue around well-being. We are inherently social creatures. I mean, that's what it comes down to. We need social interaction, and technology-mediated social interaction is not enough. And as I mentioned, we know it's rewiring us to some degree. I so I watched a couple classrooms who were reintegrating as far as like coming back in the classroom. I've spent the past few weeks at some summer camps that we were doing some consulting work for. And as I mentioned, what's amazing is there is that hesitation, and you can watch it. You can watch that kind of fear and anxiety in the students. And I think being aware of it is the first part. That would be the first step to me, is recognizing that some students will kind of struggle. Now, hopefully over the summer, they're able to start interacting with some friends and some of that's overcome. But I think it's important for teachers and administrators to look for it. The second is to facilitate it by doing it. This is one of those things that as I've watched various ways of doing it, I haven't seen a right. I've seen some more questionable on the wrong side, but I haven't seen like, there it is, that's the right one. What I've seen is just leaning in and doing it is the best. And there is a barrier there. There is some hesitation. You as a teacher are gonna have to go look for the students who are being alone, right? And that's especially what I would look for, is the students who are by themselves, right? That's what I noticed at these camps more than anything in some of the classrooms, is there were probably 4 or 5 students, about probably a 10th of the students, who were afraid to just interact. And it required a teacher to go over, talk with them, and bring them into the conversation. And so that's the other best practice that I would probably share for that, is actually approaching it from that way, is actually going to those students, watching out, making sure they're there, and then just do it. Just have a lot of fun. They need it. What's amazing is when we opened the floodgates at an experience this past week, you couldn't contain it after it started. The students were ready, the teachers were ready, everyone was having fun. And it took time, but once it was there, it happened very naturally and normally. But again, I would just emphasize, look for the students, especially those who are alone, who are struggling. And second, it may require a lot of one-on-one going out, reaching and pulling them in. But from a larger sense, I would just say, make sure that there is some social interaction, at least every hour in that classroom. Doesn't need to be a huge structured 15-minute recess time. Even a 2 or 3 minute, turn to your neighbor, share what was something hard you did last weekend that you were able to accomplish. Those short 30-second social interactions are what we're looking for.
Thank you. Our last question is coming from one of our CDC public health scholars, Mr. Nguyen.
Hello. So the question is, what ways can we support high school students that are working to support their families as well as going to school? Do you recommend creating various learning programs such as hybrid schedules for students with varied needs?
So this is interesting. The data, and I'm really curious from our school administrators, maybe we can get to this in some of the next portion, their experience with this. We have found in some of the anecdotal work we've done that having all in person works really well. Having all online, you can make work, but doing some online, some on person, that hybrid approach at the same time can be a little difficult, especially for the teacher. How do you manage the students on the screen versus in person? How do you make sure you're getting everyone? It can be really difficult. But we know that we can be much more flexible now. So my general recommendation, and again, this is where I would love the administrator's thoughts on this, so feel free to put in the chat or other places, is to be more flexible, to provide more opportunities for students who are non-traditional learners, whether they're a single parent, right? Whether it's, someone who has a child and has kept it, whether they're working to support their family, whatever it looks like, support them, give them that online option, right? Let's support them in their well-being and overall, especially on this issue of equity. But let's make sure that it's in a way that helps everybody grow together. We don't need to always do this, half there, half the group online, trying to Zoom certain people in while you're teaching a lesson. The Zoom goes down, so those few learners miss out on some of it. We have to be aware of some of those things, and that may not be the best. But we know that having all those students together online is a really great way to do it. And we need to facilitate more of those options. We need to facilitate more of these special vulnerable learners who we don't want to lose, who need to graduate. And we can do that much more online.
Thank you. Mr. Wright, you mentioned wanting to hear from our school administrators. So we do have a couple questions that we'd like to pose to our two school administrators. And our first one is coming from Ms. Lloyd.
Yeah, so what kind of changes and practices have you seen being implemented during the pandemic? And specifically those that are adapted to facilitate schools in addressing the health inequities we've discussed in this forum so far, such as food insecurity, quality access to education, physical and mental health. And do you think that these practices should be continued in a post-pandemic world, or how they could be altered going forward as schools are reopening next fall?
I guess I can go first. I would say the first thing that we've seen, and I think it's been echoed throughout our presentations today, is just this idea of everything that we've been resistant to, and all the no's that we've accepted or have had to deal with, we've had to be really flexible. So you look at some models that were previously very normed in schools, like home visits, and then we moved away from that. And now, because of these, because of the pandemic, we've seen teachers and administrators and our yard staff and the team that we have at our schools reaching out, calling, having more of that human contact. And for many, even dropping off computers for those that maybe didn't have transportation, or families were, otherwise unable to come to the campus. We've seen, just looking at the well-being of students, everyone uses that idea of the whole child, that we've been forced to really value qualitative data. How are you actually doing, which may not be reflective always on a state test. And so being able to value that qualitative data and using that to drive curriculum. The support of our teachers, I think, unfortunately, before this time, families, parents didn't always know the kind of learner their student was, or to really value all of the things that teachers were doing. And now with the remote instruction and the hybrid instruction, you actually can see your teacher. I think the barriers teachers often had of, I don't want to be recorded, we're over that now. Everyone's been recorded. So the opportunity to learn from each other, teacher to teacher, that collegiality, the idea of feedback, you're getting feedback from parents, from kids, from each other. I think that veil has come down, and it creates a great opportunity for us to create a community of learners, or to nurture that. I think also just the idea of how we monitor success, looking at things like how many hours of homework students have. I think that's become, a lens in education now. How long are they on the screen? How much reading are they doing? How much actual homework? What are we actually grading? All of these things are valuable conversations that are overdue in education. And I'm hoping will be ongoing conversations that my colleagues, administrators, and districts will continue to have. I think also the idea of well-being, not only for our students and their families, but also our teachers and administrators, has been an ongoing challenge, but a positive journey as we look at what does it mean to be an educator. And your role is not just in a classroom, but also being a member of a community. So I've been, there's a lot of things that I would say I'm hoping that we will be able to keep. And when I say we, not just my school, but educators in our districts in our state. But I also know that there's been a cost to many of this kind of trial by fire that we've had. And I know that we have to spend the next year acknowledging there's been a cost, and being prepared to, I think, prepare our teachers, our students, and our just whole school community to do better and to value that qualitative data and keep asking the questions, not feel like, oh, we've asked enough what's happening in your household, but that we really want to know in an effort to support, not just to gather data.
I think for me, I think of changing the leading indicators of what we consider to be successful students or successful schools. I think the pandemic taught us to look at things outside of our classroom spaces to see how schools and students are doing. And I think I guess I fear that we'll go back to just looking at traditional data, SBAC, ELA, math, attendance rates, graduation rates, and that we focus on those lead indicators, which leave a lot of students out, because then we're just focused on pushing those bubbles in those areas, and we're not looking at all students the way we should be looking at them when it comes to just wellness and health outcomes. So I think we need some solid ways of collecting data, such as food security and how schools are doing in that regard. So I think that's one of them. I think the maximum flexibility, that we prove that people control the decisions of what we choose to do and not do in education, and that just as easily as we had to be in school every day, we didn't have to be in school every day, and someone made that decision so that it is possible to have flexibility with what we do. I know for myself at my school, I'm trying to think, how do I leverage and be cautious about how I use assessments and dive into assessments. And I went down this whole rabbit hole. Why do we need assessments? How do we use technology to assess students? Well, we need it because we don't have quality time for educators to actually look at student work in a meaningful way, enough time to provide adequate feedback, because they don't have a lot of time to plan, to organize, to collaborate with colleagues, to really sit down and have meaningful conversations with students about where they can improve in their writing, in their mathematical practices. Everything is rushed. And so I would hope that from the pandemic, we don't lose the opportunity for asynchronous instruction, to provide a space and time for teachers to collaborate, to create, so that it doesn't count on as an absence or against our 180 days of mandated instruction, but that teachers in schools say, hey, we have a couple of days that are asynchronous for students. And during that time, we're going to do one-on-one conferencing with students, like 30 minutes a student, 20 minutes a student. We're going to embed days for teachers to meaningfully plan together, to meaningfully analyze student work. In our progressive state of California, which I don't get, we always say more school days, more time with students, and not enough time for teachers to plan, give meaningful feedback, get better at their practice, sit with students. So I am hoping, and I'm advocating, so if you're out there and you make these decisions, to not lose the synchronous opportunities that the pandemic showed us that we have. So that's one of them. The other, I know around youth employment, I started hiring my own students when I saw that I'm in South Central. So I saw 30% of my seniors started working more than 25 hours a week during the pandemic. I started hiring them. So I was like, work for the school. Like, I will pay you. And I think that's a program I'm going to keep, of hiring them as mentors and saying, if you need jobs, don't work somewhere else, work here, help our school as tutors, as whatever, making phone calls, helping us reach out to families that we can't find, like, just help us do this work. And that's like another shift that I would want, is to make sure we are creative about that type of programming. And then also the use of technology. What kind of technology? Because I know our district's purchasing Chromebooks in mass, but we just had like this video where the district highlighted a student saying, oh, during the pandemic, I learned how to use a MacBook because I've never had one. And I had to figure out how to use it. And I thought, wow, that's like sad. Because even though we're getting everyone Chromebooks, they're not that easy to use, and they can be really frustrating and cause that distress for students. And so like actually high quality technology for students, I think is a right, that students shouldn't have to wait till they're in college to have access to a MacBook or technology that is efficient and can handle both Zoom technology and applications. And then obviously for me, it's been the access to broadband, because my school was in an area that does not have broadband access. So that's been a huge issue that I know the state's starting to fund due to the pandemic. So I hope as we come back, depending on the areas that you service, to be mindful of the applications students do and don't have access to when you leave assignments and you send things to be done at home. A lot of the Wi-Fi that students were using, even borrowed from the district, was not strong enough to sustain some of the platforms that teachers were leaving as assignments and things like that. So being mindful of what students do and don't have access to, and ask the students. We surveyed our students, what applications are hard to use? And based on that, we made changes. We said only Google Suites, because all of the students did not have sufficient signal to use their Chromebooks. So most of them were using their cell phones to do their assignments. So we said everything has to be cell phone friendly. so that the students have access, at least in my community. So serving students in terms of the moves you're making as a school or as a district and seeing what they're experiencing on their end and then making those adjustments.
Thank you both. And we're going to quickly do this last question posed from Mr. Wright to our administrators.
I cannot, this is why administrators are amazing. That's all I'm going to say. Like, thank you so much for those comments. Those are absolutely amazing. One thing I often think about is just this idea of as students come back, there'll be potential gaps in knowledge, because of this remote experience over the last year and other things. So how do we ensure that when students do come back to in-person schooling, that they are adequately supported and supplemented without making them feel that they're responsible for not being caught up, that it was their fault or kind of adding some of that pressure or stigma?
Yeah, I mean, I think this is the $10 million question, right? In terms of, our goals of returning back to school. And I think the first thing is just the number one thing is remembering that for many of our students, school is home away from home. And for some of them is the place where they get to be kids, where they get to be, hopefully that we create a space where they can be whole people, where their needs are met, not just academic needs. So I think, the first thing is really continue to create a space that's welcoming, and that the main goal is not solely about, driven solely by grades and scores, but also that we have a different metrics for how we want to measure success. I think probably more than ever, the idea of kind of creating that the community and how each member is valued is going to be really important as people come back. All of the orientations and thematic work that we do in the beginning of the year, focusing on skill sets is going to really drive the curriculum. I think for most of us, we are looking at outlining units and already knowing that it's going to have to be a review and wrap around, building off of those foundational skills. Assessment is not necessarily a bad word in that we'll need it to kind of know where students are. And there will be some need to measure that to know where we go. I know for our school finishing the year, we did use some assessments just to kind of know where students were finishing, but also knowing with that gap of summer, that may or may not tell us a whole lot about how we begin. So we have to have some plans in place to know that there will be a lot of wraparound looking at those power standards. I think also being real intentional about the focus on the social reintegration, looking at models, and every school is different. Whether you're in high school, secondary, or elementary, there may be a model of advisories or homeroom, but having some structured time where you get to kind of get back to how are we doing and get back to some of those human development skills of checking in will be integral to what we're doing next year. I think the other thing is also the parent engagement. I've heard a lot said earlier, and I think is definitely the lessons that we will continue to take with us around things like back to school night and parent conferences, and having the flexibility of having Zoom conferences or virtual conferences to be able to welcome families, to integrate them back into the school system, to educate them on the systems that we plan on using. So often we have focused so much of our time around our students and not as much time around their families and who supports them. And so as we plan the new year, that's definitely an integral part of our planning for our next year. And I think the last thing is just that student support. I mean, I know for us and as well as what drives most of, people I know who are administrators is just that idea of student support and what will that need to look like next year. And as we look at our budgets, looking for what will our social support and our mental health support and our educational support need to be based on the students we have. So creating some structured time for teachers to, as Cynthia mentioned, have that time for training, but also just wellness. Like how do we, kind of resuscitate and revive our educators to be ready for a new year, but also give them the wellness that they'll need to get through this next year. So also planning for some teacher wellness and support is definitely a plan as we jump into the new year.
Thank you, Ms. Jackson. I know there's so much more, and Dr. Gonzalez, we can hear from you too. And I'm recognizing the time here, we're at 2:35. So thank you all for coming to our session today. And there's more time. So we're gonna do some brief thank yous. And then for those of you that are able to stay with us, we're going to open it up to an open dialogue for all of you to participate in for some networking dialogue with the administrators and with each other. Here's some more of this great sharing and collaboration. And first, I'd like to really give a special thank you to our speakers, Dr. Edith Omwami, Mr. Joseph Wright, and our administrators, Dr. Cynthia Gonzalez and Ms. Germaine Jackson, along with our CDC Public Health Scholars, and all of you for coming to today's session. It's been a great two-part series, and just seeing all of the participation both here in attendance and through the chat really speaks to the dedication and thinking that all of you have around this really important topic. So with that, we're going to transition into our optional networking and discussions session. Oh, one last piece, there are some resources that will be sent out. We'll share that at the end of this networking session. They'll also be shared via email after this session is concluded. So we are going to start with our first question, and this is an open dialogue for everyone on the call. So if you want to participate via the chat, or if you want to raise your hand, we can call on people to respond as well. Our first question is in the chat and also out loud here. Supporting the children with the resources they need is important, and creating a better supporting, encouraging environment at home is even better. So for everyone here, how do you imagine schools can collaborate with different organizations, the community, to support children and family and their families to a certain extent? What does that look like? And any of our panelists that want to offer, or any of our audience members?
I mean, I can share. I think that's like a passion of mine, is really being community centered. And I think one is, as a school leader, you really need to be out there and encouraging your teachers to be out there, getting to know who the key community members are, community nonprofit organizations are, connect with them, partner with them, meet with them, make sure to find out. When I meet somebody, I always think, and I don't mean this in a bad way, but like, how can I use them? I'm like, how can I use this person? I just found out they have this talent. What am I going to ask for my school and my students? And I think there's potentials with everyone, and it might not be done in a formal setting. It might be out at a restaurant that you bump into someone, that then you realize, hey, wait a minute, there's this connection to my community space. Like, how can I bridge this relationship to support the school? And so I think it's important to have teachers in your school that also have that philosophy and ideology, because then it just expands the network and the reach that you have to support your students. But then as a principal, it's also your responsibility to not just pack up and go home, especially if you live really far from the community that you serve, but to say, how do I get invested with people who live in this space? Not just students and their families, but their networks, the places that they go to, the people who lead in those spaces, because then that people really see you as a part of their community, and they'll relate to you in a different way, and the impact you have on the lives of your students will be felt in a greater way.
Yeah, I think I probably would just echo what Cynthia said. And I think being authentic is really important. Acknowledging within your school community that culturally people partner and gather in different ways. So really learning what are those different ways and being authentic in how you approach it. I think it's nothing worse than being that one time, that one moment you show up for the meeting and then they never see you ever again. I also think when we talk about the beginning of the year, that is also a great way to do some bonding with your staff, which is to learn about your school community, being able to actually have them learn about the school community and home communities of your students, and looking from that from a positive standpoint, not a negative or deficit standpoint of, oh, what do they need? We've got to go find things, but really acknowledging that there are lots of positive resources in our communities and finding out ways that our teachers and our staff can be knowledgeable of those resources. So all that information is not just housed in your student support team, but I do think it's a great way in the beginning of the year, as you start your orientation with your teachers and staff, to have an activity where you're able to go out in your community and really honor the cultural diversity within your school, knowing that every place is not going to be places we learn when we go to school. It's like, oh, the town hall meeting. Well, some people may be gathering at the church. They may be at the park. Some of my best meetings were at the basketball games when everybody would come, and my head of school would always say, there's so many people here. And I'm like, well, there's something to be said about where people gather. And so you want to value where people gather, and authentically learn more about that and be there with them.
Yeah, what you're both saying really resonates with that idea of making sure that you're an integrated part of the community and that you're in partnership. It's not that the school is there just to provide services, but that everyone's working together, and that you have value in that community. You don't need to import things. There's homegrown resources and things that can be used within the community that are of so much value and importance to building that in your schools. Any other comments in the chat? That visibility with, having meetings regularly, see that in the chat, being available in different ways, thinking flexibly. Maybe this is one of those ways that we can really think flexibly outside of the box and gathering and with other community resources. Any last comments in the chat, or you can unmute yourself and share.
I did want to share on that last question that was asked around students and their learning gaps, because one of the things in my school, like our students have always had a gap if you looked at where they're supposed to be based on like standards and how that's always existed. If anything, the pandemic is helping me reframe how I think about that, because we've always experienced it. So we've always done our whatever it is we need to do and just meeting the needs of students, And now that everyone's talking about these gaps, now that they're like gaps that everybody's looking at and not just schools in like high need areas like mine, I'm really trying to think of an asset base of like trying to inventory what students have learned and find out like what skills they did develop over the break, and trying to center what students did at home or via work, because a lot of my students were working. So what were the skills in your working environment that you're bringing into the school now? Instead of seeing it as a gap and focusing on that, is like focusing on what they learned and what they're bringing in with them. And I think a big part of that is also trying to, like, I'll have an example, like we have a documentary filmmaking class and I met with the teacher and I'm like, I want them to focus on wellness too. Like, what's their cultural wellness, their individual wellness, culture at home, like how do they do wellness as an individual, family or friends, like what do they do? Go to the skate park or whatever, and trying to like center the practices that students already have engaged in during the pandemic or even prior to the pandemic, and like incorporating them into the school. And then using our advisory curriculum to really give them opportunities to create videos of themselves and tell their stories, and kind of more of an empowerment lens of the work. And trying to, I know we need to assess, but trying to then make the assessment not the leading indicator, right? Like we're gonna just value them as human beings first. I think that's the approach that one of the suggestions my ILT had is co-creating the syllabus at the beginning of the year. So instead of the teacher showing up with a syllabus already made, saying, we're going to make this syllabus together based on what you guys feel are some of the areas where you'd want to prioritize your learning this semester, and co-creating the syllabus with students so that students get to decide and have voice in expressing what their needs are. So I did just want to share those ideas.
Thank you, Dr. Gonzalez. I think pushing against that idea of learning loss especially as we transition into the new year, is going to be so important for everyone's well-being, because we know that anytime we focus on a loss or a deficit, it doesn't achieve anything for the students as far as really thinking about their holistic or well-being state. So rethinking that to what did you gain in this experience? What learning did you gain, and putting value on that? I love that idea. Thank you for that. Our next question is from Ms. Lloyd.
Yeah, so reflecting on both parts of the equity forum that we've participated in, what would have you found to be the most surprising piece of information or statistic that you've heard throughout either today or last Tuesday? And what is something that you learned about the connection between education and public health in total?
Yeah, again, so open up to the audience. You can either unmute or share in the chat if you joined us last week. You can reference back to our guest speakers, Dr. Kuo and Dr. Watson, or the panel that spoke, or today's session. Or Dr. Gonzalez or Ms. Jackson, if you have
We're
some
giving
reflection.
wait time. We were like,
Yeah, I
I know, we were trying to give the lag, the Zoom lag time.
That's like, should
I
I
know.
unmute? Should I
That's
not
right.
unmute? And they should just go ahead and unmute. I'm sure there's someone that
Definitely.
has a thought. More than just one person that has a thought. So I'm trying
Yes,
to-
please.
Yeah, we're allowing processing time.
One brave soul. All we need is one, and then the rest will start joining.
Agreed.
Anybody? Anybody? I guess I'll just share. I think for me, more than anything is, like, I've been really reflective over the last few sessions about how my work is shaped by these experiences, by hearing professionals in these spaces, but also shaped by the demands of my district as an official school administrator, right? So that I can take all this learning and then it sits on the wayside when it comes to then how the district decides to prioritize my work for me. So I think my reflection piece has been how I do both, if it's possible to do both, politically to like keep my job, but then also like frustrated and being like, how come them not knowing this information don't change and shape, one of the larger research institutions in the city is leading with this work. Why isn't this large school district leading with this work? And so to me, that's been something that I've been processing, including I actually just met with Dr. Watson. That's why I was on the call with before this, because I'm like, I want to figure out ways that I'm very intentional about centering wellness in my schools. And his presentation to me was like, it left me thinking like for days. And so I'm like, there's, how do we change the narrative of what education looks like, of what that looks like in the actual logistical demands of our role as school leaders? Because we can say all of this, but then at the end of the day, they're saying, your attendance chronic is at this rate, it needs to be at this rate, and the conversation isn't about how do we create your school, how do we make sure that your school is a welcoming, safe space, how are we assessing student wellness in that space. If we're not having that conversation and banking my administrator meetings, engaging in that dialogue, then we just kind of keep on doing the same thing and espouse a narrative that we don't actually follow through action.
Yeah, I mean, I think I too sat and thought a lot about, in particular, his research. And I think, so often we esteem ourselves to be data-driven in a lot of different ways. And I'm wondering how the data that he shared, and I know it's ongoing research regarding the telomere data of just like trauma that we're all experiencing, whether it's the pandemic, whether it's racial inequality, whether it's just, life, public education, the disparity between that and private education, the disparity between resourced and under-resourced. And I feel like that data, it will hopefully become more powerful in what drives us, because there is this ongoing kind of battle that we have between the qualitative data and quantitative data of, what do the numbers say? And we all know it all depends on the metrics we use for measuring that. And, there has to be good that we take out of the pandemic, and we're hopeful that, we start to use these other forms of metrics to guide our practice. But I too was very moved by the research that he's doing, and am hopeful that as colleagues that we can work together to push our, agenda, which is, not just educating children, but about being a safe place where, children can grow to become thriving adults. And also that we have thriving adults in our learning environments who are teachers and educators and para-educators and all of the staff that support, and that it's an environment where they want to stay. I mean, there's so many administrators that have left after this year, and so many teachers that have chosen not to return to education. And so we create a problem of which we won't be able to solve, which is not just educating children, but having no one to educate them. Yeah. So I'm hopeful that, sometimes you don't really know what the tipping point is, or what data resonates more for those who make decisions. But I'm hopeful that that kind of data that he presented can be used in a way that leverages our agenda.
Yeah, thank you. Sabrina, we're noticing your comments in the chat. We'd love to hear also from you out loud if you're open to unmuting and sharing some of your thinking from Dr. Watson's talk last week.
I really enjoyed his basically the history lesson that was brought forth. I really did enjoy the telomeres, how they encompass essentially Black people's day-to-day life, like, if they're stressed, if people have died, if different things have happened in their life, and it corresponded with their adjusted age and their chronological age. So I really did find that really very enlightening, and as well as a couple of other things that he mentioned. It was very good. I really enjoyed it. I specifically enjoyed how he did give a little snippet additionally of more of epigenetics and Black history. That is something, I'm African-American myself, but that is something that just does not get taught in schools. So when, I'm sorry. So my work phone is going off. So when it was, when he spoke about it and he brought this all up, this is like, yes, finally, it's being shared with other people that are in the positions to teach about it, to share what they learned. And it was very, I enjoyed it. And I mean, especially with the stuff that's going on politically. Yes, we did get Juneteenth, we did get a holiday, but we also really would like for our history to be taught in schools. And that is something that, you know, is still a power struggle. So hopefully they may consider bringing that to life, and then hopefully that could help health equity and health equality come about. And I remember and my public health program, I remember seeing those little boxes of people looking over at the field, you know, using one person could see over the fence, another one was barely seeing, and one just wasn't seeing anything. And it was really good to see, you know, how it all ties in, and you know, and if we really want to continue our work and to bring about that health equity, we have to look at every group. And as one of the educators was saying, for her students, a lot of them work, so she hired them on, so they did not have to go out looking for other jobs. And I think she also mentioned about the internet service, you know, about them not being able to know how to use computers. And so that was like high-tech computers, not computers, but high-tech computers. So that's something that I really, really like, that she took that approach as far as it came to learning from what she had seen in the beginning of it. And it's like, okay, let's try to incorporate these things to make it where our kids have access to these things, because, you know, until the pandemic literally shone light on exactly how big of a discrepancy it was, nobody really knew. And so I really liked it. It was really good.
Thank you. Thank you so much for sharing. And we're going to move to our last question. Mr. Nguyen is going to offer it to the group, and we'll have just a little bit of time to discuss it as a group.
So the last question is, if we think about true equity, we would make sure that quality health is not correlated to educational level. How do we use our collective power as school or within your own field to demand quality healthcare for all, those with formal educations and those without?
So again, feel free to unmute or share in the chat. And thank you, Alicia, for your comment in the chat as well.
I guess I'll answer that. The pandemic taught us that these health inequities have real dire consequences. And for those communities that these health inequities have been pervasive in are the ones who suffered the most loss. And that's gonna have an impact on these families for generations in terms of their ability, especially the fact that a large number of those who lost their lives were like head of households, like men, Latino men especially. And I know in my Florence Firestone area, the South LA area, and the Southeast, it was predominantly Latino males, predominantly people's fathers and head of households, and what that does to the family's economy, but then the larger economy in that community and space. And so I know my dad never had a high school education. So I think so long as in our country, those outcomes are, you know, connected to educational outcomes, that we're not going to have healthy and thriving communities. And so that we really need to think about how we make this accessible to everyone who's living in this country, so that we don't have to continue to maintain the inequities that have existed.
Thank you. Any other last comments? I see a hand up. If you, yeah, go ahead.
Okay, I'm one of those nerdy trustees that teachers usually boo, but during this time, I have been on so many webinars while I'm working to educate myself on what to do. I just finished a 4-modular course on governance with the equity lens, which really educated me on things. On your question in particular, Mr. Nguyen, I think that's how you pronounce your last name, I'm sorry. We actually in our district partner with Little Company of Mary, Providence Little Company of Mary. They bring the van to us once a week, and we make sure our kids can go on there and have appointments, and we encourage our families to enroll in California Cover Recovered California. So we try to provide all kinds of health issues for our parents. And we're a very low socioeconomic area. But I just want to share really quickly something that I learned, and I'm pushing it in my district. I'm hoping the leaders who make those decisions come up with it also. And it's the restorative restart. And if you look at the word restore, it's having the ability to restore health, strength, or a feeling of well-being. And then restart is what we're going to do in the fall. We're not going to reopen our schools because we never closed the schools. We just taught the children in a different way. And so we're going to try with the restorative restart, and we're going to take it slow to move fast. We're going to take time to look at the health of our children, at their mental health, and our staff to see where they're at when school starts again, before we start pushing the academics. We know we have to move fast after that, but we're going to move slow and then move fast. We really have to look at the mental health of what these young people have gone through during this time and what our teachers have gone through. So as far as that's concerned, that's my input for today.
Thank you so
Sorry.
much. Yeah, thank you for sharing. So we've come up against our ending time today, and I just want to thank everyone for being participating in this two-part series with the Fielding School of Public Health and the School of Ed and Informational Studies. Clearly, there's so much more that we could talk about around the intersections of equity, public health, and education, and we hope that this conversation will continue past today. You will be receiving resources via your email, and also there's a recording of both this session and last week's session that will be available. And really, thinking about what Dr. Gonzalez said about being in the middle of systems that maybe aren't talking to each other around looking more at well-being and holistic approach to education, and then what our systems are demanding out of us. I really want to emphasize that that's why collaboration is necessary. It's I think the world of education and public health really got blown open with the pandemic, and so now just really leaning in, if we were to lean into something, leaning into being collaborative across spaces between public health and education, and being able to resource each other, spread the word more broadly, especially with people who do make those intersections like Dr. Watson, so that we can share this information with policymakers and decision makers to create real change in our schools. And I am hopeful that everyone that's been part of this conversation is part of that change. And as Dr. Howard said in our first session, we're all going to roll up our sleeves and get to working on that together. So with that, you'll see the resources on the screen. Thank you so much again to our speakers for being available and sharing all of your insights and information, and all of you for joining us for this two-part series during summer after a long time. So thank you all for joining us, and we'll see you next time.